I will present cases that we are doing right now in Niger, where we are based. So to set the context and the scene, I would like always to put this map to show how serious it is and how we need to react. This is authority, the IPCC report on 1.5 degree. You know, that report that was done by IPCC under the Paris Agreement, showing that, you know, what will be the climate looks like if we are at 1.5 degree of global warming. And we're quite there because, as you know, it was 1.4 last year, and even some places are more than that. So you can see that if you look at the extreme temperature, you see that there is no blue, the temperature will be increasing, of course, and Africa is lays a hotspot, especially the Sahelian area and the Saharan desert. So we really need to act. We need really to start anticipating these things. How do we deal with that? And there are a few experiments in Africa that works very well, and I want to present this one that was done by the Senegalese Met Service in collaboration with the public health. That's where we want to see it, a collaboration between climate and health happening. And what they did is looking at the climate forecast, whenever they forecast a heat wave event, whatever they define as a heat wave, they will put out the vulnerability. Vulnerability is just what, you know, how heat wave will affect people depending on the environment. And then they build this bulletin and create a map of risk, of impact, and then disseminate it through all those districts of hospital and the government and also the people. And they put an early warning into that so people can. And this bulletin is made in, over Senegal. It's a quite good experiment that's happening. So our role in AGMAT is really to be, I just put this one to show you what we are doing. This is not the purpose, but to give you an example what we are doing. We collaborate, this time also was with Vito, we collaborate, you know, try to see that where is the science, starting with good data, best modeling, whatever, and try to develop tools of decision making, ensuring that decision makers, communities can use that tools easily and to react. And this is one example, a project that we did, CleanTag, and CleanTag is the name of the tools, and to see how people can make decision, better decision on the field, what to do. And that's really what we want to do. We want to ensure that it's not just climate information itself, but it's just what is the decision to be made on the field. Saying that, we know that full well from the last IPCC report again, that climate change is already happening. What does it mean for us? More extreme event. Dust, flooding, heat wave, of course, going to be more intense and more frequent. That's for sure. I mean, the community agree about that. What do we need to do? In the context of Africa, we know that we cannot withstand on those extreme events. We don't have the proper infrastructure. We don't have the proper means to do that. So our best strategy, our best adaptation strategy is really to anticipate. Also develop what we call preparedness, or we call it early warning system, what you want. So we need to be prepared to know that the event will happen and to ensure that we can avoid it as best as we can. So that's really the climate information that is important for us. Ensuring that we have the climate information and people can get ready and minimize loss and damage. How to do that? So I'm presenting a work we are doing with Vito to tell you the collaboration between North-South and also why it's important. Here we are showing that if you look at the climate, I will talk about the climate, and even if you look at other also important information, for example, is population growth. We know in Africa the population is growing a lot. Doesn't mean more city, you know, some neighborhood will develop around the cities, as you know, in Africa, and will create another problem of heat. Heat will be really a problem. Not only the temperature is going to be hotter, but also the environment itself will create more vulnerability for population. So what to do? What is really the response we need to propose for that? The study that we made, it was made within climate scenario. Scenario is just our best, you know, our best projection, our best forecast in the future to tell that what will happen if, you know, we have this climate information for many scenarios. The scenario, this is the present. We have to compare always, comparing what we have to the present, you know, period. And you can see that if you look at the number of hours with extreme heat stress, it's going to be increasing. For any scenario that you look at, it's going to be increasing more and more. And the scenario is just, you know, how likely the greenhouse production will be in the future. If you look at the risk in mortality is the same, it's going to increasing as well. So this is really what we are going to face on heat in the future. So what do we need to do? So what we also, another information here, is to look at another hidden information, if I can say it like that. Sometimes we measure just the temperature that we have, which is ambient temperature. But we have more than that. If you look at how we built our houses, how do we build our cities, and you measure the temperature on the shade, or in-house, sorry, inside, indoor temperature, you can look at a very huge difference. Here is an example, just showing the temperature, average temperature in blue over the shield, and looking at the temperature really in indoor. And you can see there is a huge difference. Even so, you take the temperature today was, let's say, 45. What people really feel inside is more than that. And depending if you compare temperature and use humidity and those kind of things, so people feel more. So there is another thing in the story you need to take into consideration. It's going down here. So what do we really do our approach? And I want to insist into that. Climate information is only one part of the puzzle. We really need to engage with community, ensuring that the decision makers are at the outset of the proposal. So what we did here, we do all both the science, ensuring that we are making accurate measurement on what's happening really, what is feel inside the house. And here, what we are showing here is bulb temperature, and you can see that it allows to measure exactly what you feel when you are inside, indoor. And also, we engage population. Here we work with Jeune Volontaire of Environment, which is a youth organization in Niamey, to ensure that they are part of the project, not only user, but part of the project at the beginning, making the measurement with us, going to the community with us, and also we use them for communication. Of course, we have the city of Niamey also. We are part of this proposal because the last decision in planning and everything depend on them. So we have them also in the proposal. So what we are looking at to do at the end of the project, with the population, we want to ensure that we have solutions that is, useful, very approachable for them, and they can do it. And what we propose is having some shades in Niamey. Everybody will know Niamey in the Sahel is very, very hot, and having just trees, planting trees can solve the problems and can really reduce the temperature. And the outcome of the project that we need to do is something like that. It's in French, sorry for that. It's just planting trees, of course, ensuring that we have the early warning to tell people what will happen when you have what temperature. Based on our focus, we can do it. Develop some strategy at the long term, and ensuring also everybody know what to do, and also we ensure that we build some kind of places that people can reduce the temperature a lot. And of course, minimize the risk on that, and ensuring that everybody, people working outdoor, and all those people are getting the information, and they can be ready for it and implement this. So what we think, what we will do, if you look at the right side, is planting trees with the community, ensuring the community as with us. We go with them, we plant trees around Niamey to ensure that at least the temperature will decrease depending on, how do we plant tree around Niamey and how do we do it. And we want to engage the city on that, ensuring the city of Niamey is also a part of us and developing it. And this is not built on nowhere. We have this project going on, and we have really one first phase that we have done, make some measurement, and know really exactly what is the impact, or what is the added value of having those trees and those shade over Niamey. Now what we want to do in the project, this is my last slide anyway. So what we want to do in this project is to ensure that only we do it very properly in Niamey, doing many places, because we are doing only pilot phase, and ensuring also when it works, we document it very well with the science, with the measurement, everything, and also upscaling it. Because as I told in the beginning, us in AGMAT, our really role is how can we take experience, good practice somewhere, and brought it in another place in Africa. Oh, okay, sure. That's the last. So ensuring that as AGMAT, as an African center, how can we ensure that all those good practices, we're going to upscale it in different styles. So we need that, as I was saying, evidence is very important for us. We need to be evidence-based, ensuring that everything is documented, very well, and we know what we are doing. We want to ensure that also where the decision is made at the local level, at the neighbor, at the district level, we want to ensure that people get the information also. and working also with those decision makers, like the city, the mayor of Niamey, ensuring also those youths are there. As I was said in the beginning, really climate change is here, is something that is real right now. Any Met service can tell you that we receive those things. And one sign, one big sign, that's why we call it global warming, is temperature. Temperature increase is really the very clear sign of climate change. So we need to do something. That's why we want to do some early warning on heat wave to ensure that the population are well prepared based on the state of science. And now, that's only one part of it. The other part also communication, ensuring people are getting the information on time, and everybody need it, they get it on the right channels and everything. So this is really what we want to implement and working with Vito. And thanks very much for that.
Thank you, Dr. Usman, for setting the scene and immediately also not just highlighting the issues and challenges, but also directly show concrete examples of solutions, implementations on the ground. We have time for one or two questions for the next speaker, so if any questions are there, please raise your hand. I think I can bring the mic. Okay, I think still processing the first information, so let's move on with the second speaker for now, Jan. Also at the end of the session, we'll have some room for a more wider discussion.
Hello everyone, can you hear me well? Okay. So I am with Vito at the Environmental Intelligence Remote Sensing Department as a business developer, and today I'm a substitute for ECMWF person, so don't expect from me that technical details as you would probably from the other participant. However, I would like to share some insights on our work on drought, and our cooperation with ECMWF is also really a core in this work. So a bit of introduction to Vito, if you still don't know. You can see a lot of people cruising around. There are about 20 people from Vito here at G-STIC. So talk to them if you want. We at Vito, at Remote Sensing, we do basically all the remote sensing stuff, starting from, basically we don't do the genomic selection, but we do support the breeding data with the drones and satellites. We also support the seed production, the farmers. We cooperate on a regional and global scale with the European Space Agency, with FAO, with many other development organizations. So our research areas are quite straightforward. So it's smart farming, agro-industry, institutional monitoring system, and development cooperation. So we work with all of those, and as you can see, these logos pop up. Those are all the different platforms that we support, and these are all the long-term projects. Most of them are publicly available, so you can go there and access, register, and use the data. Some data is limited, but on most platforms it's publicly available free service and data. So here and now we are a bit more focused on institutional monitoring system and development cooperation. Our key research topics within the environmental intelligence and remote sensing operations are the productivity, mapping, plant traits, and drought. So today I will speak mostly on the drought. Just to start, to warm up, probably it's not a surprise and a news for you. It's a fully operational technology that is run now on a global scale. It's a hybridized blended data from Sentinel-2 and Sentinel-1. Sentinel-2 is an optical satellite from European Space Agency. Sentinel-1 is the synthetic aperture radar, SAR satellite that blending this data, we get cloud-free satellite remote sensing data on a global scale, each part of the world, with a 10-meter resolution. So this is available, and both on Terrascope and Copernicus data space ecosystem, you can access that data and use it in your work especially. This is specifically dedicated to researchers, so you get the free credits every month, and you can use those credits to basically access that data and analyze whatever you need to analyze. Moving closer to drought, because low cost actually is the consequence of drought and specific climatic condition. This is the fully operational service that we do in cooperation with IGAD, which is the Intergovernmental Authority for Development, and ICPAC, which is the Climate Prediction and Application Center based in Kenya. That's where we help them to predict the infestation with the pests. And as I said, it's a fully operational service that goes on. Another example is the agricultural stress index system that is also fully operational, and it's accessible anytime at the FAO website, FAO. And you can get the insights on what is the current condition for the drought. So this is the monitoring tool. And again, it's a fully operational going on. It's updated on a decadal base, so every 10 days. We at Vito analyze and submit the updates for that system to get the insights for anyone who has access to ASIS, which is also free of charge. So it's publicly available data. So just on your right, there's the scale. This is the vegetation health index. That's how we measure the potential drought effects. So doing that great job with monitoring, we also started doing the modeling and prediction, forecasting droughts. And that's what we do with the Centaur, which is a Horizon Europe project. And this project ends in 2025, but we're not going to stop. So this forecasting basically provides, again, on decadal basis, every 10 days we update the model, and it gives the 10, 30, 90 days prediction of a drought. So, and it's updated every 10 days. So this tool is, basically it has no real competition on the global market yet. There are some models, there are some tools available, but we at Vito, having all that background with the already operation models for drought monitoring, we enhance this model, and we are going to continue. So as I said, our alerts and our monitoring, our prediction of drought comes on 10 days, 30 days, and 90 days scale. That has a lot of practical use in agriculture, but not only. While I can speak about agriculture because agriculture is my major domain, and I see a lot of use in Africa and beyond. So it has quite a detailed scale. If I'm not mistaken, it's about 20 meters per pixel resolution, and we're proud having it and develop it further. So this is a little bit of a technical detail how we approach that. So that's exactly where ECMWF data comes in. So you see that CS5 members are not the people. These are scenarios. And basically, this model is the version 5 of ECMWF, where we use the results of 50 scenarios running with different details. And that's how we come with a holistic forecasting model. It definitely provides some uncertainties, but this approach with CS5 allows us to be very precise and quite high, and have very high correlation with the drought prediction for up to 90 days. As I said, I spoke with my colleague in this panel. Also, we validated this model in 3 countries within this Centaur project. It's Somalia, it's Mozambique, and Mali. However, right now we are going further. We are looking for new customers and partners, as we are moving now to spinning off this solution to more commercial use, let's say. Not obligatory, it will be for money for all public, but definitely some commercial users will pay, but some data will be available also free of charge. So our next steps with this is engaging these commercial customers. We are looking to get more feedback from these customers to enhance our models, because this early drought prediction model allows to do the input of other different data. So it's not just the climatic data or remote sensing data. It's also the other data that is available in the country. So that's the data from the weather stations. It's the data from the localized weather forecasts that allow us to be very precise in midterm prediction for drought. We are currently going through certain circles of searching the funding for expanding outside the current pilot and current model operation, and we are definitely focusing on opportunities to operationalize this application on a global scale in the nearest future. So thank you very much.
Thank you, Jan. Any questions for Jan already? Seems there is some cold water fear for someone asking the first question here. Maybe I can also orient myself to the other panelists or other presenters. Otherwise, thank you very much for all sticking to the time. It's just now up to the audience to warm up a bit and also take part in the conversation. So yes, please, Tatiana, you can take the floor with the next presentation, where we zoom in more on specific adaptation for Mozambique.
Okay, thank you so much. I think I'll use, can you hear me well? A little bit more? It's better this way. Okay. Good morning, everyone, and thank you once again, Vito, for the invitation to be here and sharing our experience in Mozambique. I'll be presenting about our response to climate change and climate extreme, and enhancing health national adaptation plans to mitigate heat stress and related health impacts. My name is Tatiana Marrufo, and I'll be talking representing the National Public Health Institute in Mozambique, in which we call in Portuguese, Instituto Nacional de Saúde. So this is the outline of my presentation. I would like to start to give a little bit of background in terms of Mozambique, which is known that is one of the countries that are more vulnerable to the extreme weather events. And the climate risk index indicates that we are the 5th country in terms of the position in the world. So this is the climate index for 2021. And of course, unfortunately, our geographical location accounts for our vulnerability. So the projections indicates that our country will experience increased temperatures, delayed start of the rainy season, and an increase on the frequency and intensity of the extreme weather events, which of course will place an additional pressure to the challenge in our health system. So I wanted also to share some of the milestones that we have in Mozambique in regards to climate and health. We have started back in 2017 when we organized our first international meeting to create the awareness within our country regarding the impacts of climate change on health. And at the same event, we released the first report on the climate and health, in which we touch base about the vulnerability of malaria and diarrhea diseases in regards to climate change. So moving on, we have organized a lot of activities such as released scenarios, which is based on risk maps for the climate-sensitive diseases. We're strengthening human capacity through trainings in different areas. We have improved the local knowledge or the local evidence through the vulnerability and adaptation assessment, but also in terms of developing our first research agenda on climate, environment, and health. We have also strengthened the surveillance for the climate-sensitive diseases, talking specifically about the emergent diseases, and we started to test an early warning system for malaria specifically. In 2023, we organized our second international conference, in which we have a lot of attendees, around 300 attendees, national and international, and we had the opportunity to have our first appearance during COP28, and since then we have been active attending to these type of events. So for this year, our aim is to approve our Health National Adaptation Plan based on the update of the vulnerability and adaptation that we released in 2019. And we are proactive, including climate and health in different type of documents, policies, and sectoral documents such as the strategic plan for the health sector, the NDCs, and other documents. This is just to show how we are trying to build the climate resilience in the health sector. So we use this framework of WHO of the building blocks, so the framework for climate resilient health systems and sustainable and also low carbon systems. And we have done a lot of activities from governance to financing. So starting from governance, we have committed to the national and sectorial plans, such as this one that I mentioned, the Health National Adaptation Plan, but we also signed the COP28 Declaration for Climate and Health. So we have trained a lot of different health professionals so that we can have climate-smart health professionals in Mozambique. So we trained frontline health professionals in the health sector, but we also had the opportunity to include some climate and health materials within the module of One Health of some of our post-grade programs, such as the Field Epidemiologic and Training Program, and also the medical residency of public health. In terms of assessments, we have developed this Health National Adaptation Plan. So we have developed this VNA, so Vulnerability and Adaptation Assessment, and we have now the Health Vulnerability Index of each one of 160 districts of our country. But unfortunately, what we can see this is not working, okay. I was trying to show the maps. What we can see in our assessment is that we have a very low adaptive capacity in the health sector to the climate change. In terms of integrating risks, Mozambique has a national observatory of health, in which one of the areas is the climate, environment, and health. And we use this observatory to understand actually the risks and the impacts on health using data from different sectors, but also from the health sector. We combine this data to understand the trends of what is happening, but also we use the data to develop some sort of predictions for the rainy season in particular. And this is what I'm showing here I'm not sure if this is working. I was trying to point in, not working, but I wanted to show that we have developed, the one that we have a lot of maps, it's the risk maps that we have been working with the National Meteorology Institute in Mozambique. Since 2018 up to now, we released the predictions for the following rainy season for malaria and diarrheal diseases. In terms of research, we have developed this research agenda for climate, environment, and health, which is part of our national human health research agenda. In terms of infrastructures, we have supported the Minister of Health to assess the vulnerability and adaptation of the health facilities per type of extreme weather event. And we deliver this information, at least the findings, to the local level so that they can have the information in terms of vulnerability, but also what measures of adaptation and strategies they can take at the local level. In terms of managing the environmental determinants of health, we have been able to conduct some researchers to monitoring the air quality, but also in terms of the waste of the health facilities. It's like some sort of initial projects, but we still have a lot to do. In terms of the emergencies, we have been able to actually include our risk maps within our national contingency plans for the following rainy and cyclonic season in Mozambique. So we are using this information for planning for the following rainy and cyclonic season in Mozambique, because I'm showing here that we have included since 2021 the risk maps. Up to now, we are still including. So in terms of financing, it's important to have climate dedicated and sustainable funds. We are part of two proposals now. So one for the adaptation, multi-country proposal, one for the adaptation fund, and another one which is the one that the country is leading for GCF, but we are still waiting for the approval of our HNAP. So in terms of HNAP, Health Net and Adaptation Plans, so we started this process in February 2025, and this process is based on evidence that we generated in the country, so in terms of vulnerability of the country. And we follow a process of prioritization of the actions in which we follow a multi-sector approach involving a lot of sectors, and we conducted a series of workshops with our technical working group to try to prioritize the action of adaptation for the health sector, and at the end, we are compiling all the actions in this document, which will be our HNAP to be approved. So what evidence that we use? Excuse me. Actually, it was the evidence that was generated in the country. The first one here are the evidence related to extreme temperatures that we have generated since 1950. The first chart that we have here, it's the tendency of increasing the temperature for the past years in Mozambique, and the maps are showing the different behaviors of the heat wave in the country in terms of the number of events, the frequency, the direction, the magnitude, the amplitude of the events. This is the kind of data that we generated in the country for the temperature. But we also generated data in terms of our extreme weather events. The main extreme weather events in Mozambique are the cyclones, the droughts, and also the floods. So historically, the events were dominated by floods, but in this chart, we are showing different colors at decades of cyclones happening in Mozambique since 1980. And as you can see, the red one is showing the cyclones that happened since 2020 up to 2024. So it's almost the double of what we were seeing in the past decades. So we are seeing much more cyclones hitting Mozambique in the past years. So this is actually the exposure that we have, and we have came up to develop these assessments. We have the vulnerability index of the health sector. This one is from 2029. We updated for our HNAP the 2025 index. As you can see, there's no much differences in the maps, but even though the exposure has changed. So, given the fact that we have the exposure, we have the evidence of the vulnerability of the country, so we use this framework of WHO so that we can develop a theory of change for our HNAP. But at the end, what we wanted is to have a health system that is more resilient, that is low carbon and sustainable, that we can definitely cover all the vulnerable population in Mozambique. And what we learn? Actually, we learned that in Mozambique, climate and health plans and strategies have been important and guided by the country's vulnerability. We need to develop early warning systems for different types of extreme events that you've seen that we have in Mozambique, and we must develop this early warning system as one of our adaptation strategies. And of course, it's urgent to address the impact of heat stress, because we are seeing a lot of this growth tendency of the temperatures in Mozambique. So we have this plan, which now it's in process of receiving a lot of comments to be approved by the Minister of Health in Mozambique. So generally, in summary, follow this process of multi-sector approach, a plan that is oriented by the government. It's inclusive and comprehensive. The main goal is to build the resilience in the health system, but also to have a sustainable and low carbon health system. We have prioritized 45 actions in this plan, and the estimated cost is around 235 million for a period of 5 years. So of course we have a lot of challenges that I'm showing here from different domains. I'm well aware that it's not different from other countries, but data, it's the main one. We do have a lot of resources in terms of lacking resources, human financing resources. The capacity is true and important and very relevant to train at the local, not only at the national level, both health and training climate professionals. And of course, the sustainability, not trying to reinvent the wheel, use the systems for monitoring, for surveillance, for information and communication that we have in place in the country. There is a lot of opportunities to explore that are valuable, that are viable, that can take us to an effective and equitative climate action. We can use nature-based solutions to reduce also the emissions, but in particular, we should have adaptation strategies that are local context-wise. And finally, what are the perspectives for Mozambique? We need to finalize our plan. We need to approve and start the implementation of the plan. We need to have, or to find a way through this plan to track and define the metrics for the health co-benefits. We need to be able to incorporate all the health metrics in different types of plans that we have incorporated climate and health issues such as NAPs, local national adaptation plans and NDCs, but it's crucial to have and mobilize and access sustainable and climate dedicated funds for all our activities. And this is actually the list of all the institutions that we have been working with in the past years, and thank you very much for your attention. Muito obrigada.
Thank you, Tatiana, for the very comprehensive presentation on the work being done and the plans being prepared for Mozambique. Only time for one question this time. Yes, please. Oh, too many questions, we'll take it later, but since
Yeah.
Tatiana took a little bit more time, too many questions now. So please.
Which one is the first mic? So, thank you, Tatiana, for your presentation. I was wondering if you can you detail a little bit about the kind of health data that you have, and if you have linked this with these climate data, for example, the malaria and the increase in temperature in the cyclones.
I'm not sure if I understand correctly the question, but it's on what we have established in terms of the relation between malaria and climate variables.
Yeah, and if you have what kind of health data that you have, and if you have linked this health data with the
Yeah.
temperature in the climate.
Yes. Unfortunately, the diseases that we have been working on in terms of the health sector are malaria and diarrheal diseases, mainly because we are generating data in routine base by the health facilities. The other type of data, for example, for emergent diseases, it's only sentinel sites, and we have a few in the country, and it's difficult to establish the relations between the different climate variables, but we are trying to do that through our climate and health activities. But we do have this information in terms of we have published already in terms of malaria and diarrheal diseases, and we tried also to publish in terms of emergent diseases in Mozambique.
Okay, thank you. I'm sorry for maybe interrupting now for the questions, but I would like to continue with the speakers. At the end of the session, there should be more time to take further questions on this specific presentation as well. So please, Nico, you to come to the stage.
This one should go, yes. Okay. Ladies and gentlemen, thank you for the opportunity to speak to you this afternoon. My name is Nico Kruse. I'm from the South African Weather Service. And my topic for our presentation this afternoon is creating a safer future for vulnerable communities. And basically it's about focusing on communities within municipalities where we have conducted two projects that I would like to explain to you at the end of these two projects, and also the lessons learned through these two projects that is related to how to improve our early warnings to the communities within, in this case, South Africa, but also in the SADC region. And I would like also to focus a little bit on some of the lessons learned that we can take into the future when similar projects are being attempted. Now, first of all, before I start with the discussion on the projects, we have heard during this conference already many times that the 1.5 degree limit that has been set by the Paris Agreement during COP21 has already been breached. And just as evidence for you, the WMO press release in January this year indicated that in 2024, we've already reached that limit. What does it mean to us? In fact, it puts us as environmental scientists, and especially us as meteorologists, having to conduct the forecasting, in uncharted territory at the moment. You can see, according to this study, the estimation was that we should have reached 1.5 degrees limit in 2034. But we've beaten that by 10 years already. So if I go back, the issue that we are facing is, shouldn't we focus more on adaptation rather than mitigation that has been the main focus of the climate discussions up to now? It's just a question that I put forward. And then later on in my presentation, I will also be looking at some of the climate finance and whether we're spending our money wisely. So, just to apply further context, during 2022, the Secretary General of the United Nations announced that the Early Warning for All project that was launched. And the idea was to have every person on the planet has got a human right to receive an early warning. And with this in mind, the United Nations actually developed 4 pillars upon which this early warning for all initiative will be based. And I think most of you know these pillars, but for you that don't know, I'll just quickly run through them. The first pillar is about awareness. The second pillar is about the observations, monitoring, and forecasting. And this is where the weather services like the organization I belong to actually play a role. Then there's the dissemination of these early warnings, and then finally preparedness and resilience building, which is the fourth pillar. The 2 projects that I would like to discuss with you today, the one is called the Integrated Climate-Driven Multi-Hazard Early Warning System. Quite a mouthful, but let's call it, for our purpose, it was funded by the Government of Flanders, so we will call it the Government of Flanders project. And the focus was on rural municipalities. And the objective of this project was to develop an early warning system, servicing those communities and introducing a concept called impact-based forecasting into the fray. You know, we always had at the weather service a forecast like it's going to be partly cloudy and mild. So what? You know, so impact-based forecasting has got the aspect, in addition to partly cloudy and mild, what is the impact of partly cloudy and mild on the different sectors of the economy? So partly cloudy and mild doesn't sound very good for the agricultural sector, but for the tourism sector, if you want to spend the day on the beach, that would be very, very nice. So the second project that I would like to introduce to you is, that I would like to discuss rather, is the early warning for Southern Africa. This is funded by the Foreign Commonwealth Development Organization in the UK. The focus here was to create a demand for nowcasting procedures, which is a tool which we utilize to deliver early warning services. And I will discuss just now what nowcasting means. But let's go back to the Government of Flanders project. You can see the 3 rural communities that we've targeted within South Africa, where their locations are. But more importantly, what are the products that we've developed as part of this, the project that we developed for, and we categorized them in certain categories like severe storms, slow onset droughts, flash floods, veld and forest fires, and also having climate outlooks. And for each of these, you can see that the project in a nutshell actually very closely follows the early warning for all pillars that I've just mentioned to you. But a lot of work was conducted in the work package 2, 3, and 4, where we developed these products. In work package 3, we also developed, I think, which is the crown jewel of this, the output of this project, was an early warning web portal. But going a step further, we actually managed to actually roll out a control room facility at each of these municipalities, so that the disaster management structures within these municipalities actually have the data and the warning information on their desks, and that they can, instead of being reactive, actually be proactive. And then obviously this goes together with Work Package 4, where a lot of capacity building and training has been conducted, as well as engaging with stakeholders and communities on the ground. There are also cross-cutting themes like gender and the involvement of vulnerable members of the community. The second project I would like to present to you has got more of an international flavor, and this is where we are looking at innovating on the nowcasting information. Now, nowcasting, as everybody knows what forecasting is, but nowcasting is looking basically at that time period of 0 to 2 hours ahead. In other words, that is the weather you feel on your backside, if it's dangerous or if it's severe. So looking at sensors like satellites, weather radar, and sensors that actually are reporting in real time. And this is what is not being conducted, we found, within the SADC region. Even within the greater African region, there are only a few countries that actually practice nowcasting as a tool to create early warnings. So just to give you a short overview of how the World Meteorological Organization is organized within the different regions of Africa. For instance, if you look at SADC, we have this entity called the Regional Specialized Meteorological Centers. Now, so the South African Weather Service is the center for SADC, and we collaborate with all the member countries. But in this project specifically, we collaborated with Zambia and Mozambique. And in the latter stages, we also involved Botswana, Malawi, and Zimbabwe. But apart from working together with the World Meteorological Organization, we also working with global institutions like the ECMWF. They are the prime numerical modeling institute on a global scale, and also with UMETSAT. So they are the remote sensing service providers for the whole of Africa, basically. Some of the innovations that was introduced by this project, I actually forgot to mention, you can see on the right-hand side, all the members that were participating in this project. It involved the Weather Service, the Mozambique Met Service, and also the Zambian Met Service, apart from also other international organizations. Then, this slide I just put in front of you, because we worked with the communities, this is just to indicate that the positive feedback that we got from the communities. But the slide at the bottom, or the section at the bottom, shows you that there are still a lot of gaps that have to be covered in order to make this early warning service more acceptable. But the punchline, or the actual core of this presentation, is what were the lessons learned during these two projects. Now, the first one that I would just like to highlight is that impact-based forecasts and nowcasting practiced separately has got very limited value. Practiced together, they form a very robust early warning system. The next section of learning was about communication and capacity building. And I'm highlighting here the capacity building and the communication to the user community, the people on the ground, that lady that lives next to the river that might be flooding in the next day or two. So those are the people that communication and capacity building had to be upscaled. And then both the projects that we've conducted has got sustainability goals. In other words, it doesn't stop at the end of the project. And I can gladly say that for the Government of Flanders project, we have actually solicited additional funding to conduct within those 3 municipal areas to actually enhance the communication aspect of that work. And then finally, colleagues, there's a lot to be said about having your product and your warnings issued in the local language, because there's a lot of misconception if you use English or any other language for that matter, because there's very little understanding of the terminology that we use. But one other aspect I would just like to focus is on the social consideration. It made me think about an article I read a while ago, and the topic of this article was, who can eat information? And the fact is that the authors of this, Colleen Vogel and Karen O'Brien, implemented this, or they asked this question related to seasonal forecast, but I draw a parallel to early warnings as well. And this is about the context in which these messages are being delivered. You know, for seasonal forecast, the people sit around the table and they have these outlook forums and they come to a consensus. When it comes to early warnings, the disaster management structures and the weather service issue warnings. It's a state of chaos, panic, and life-threatening situations. So you can see the second aspect is about what are the platforms that you are utilizing to deliver these messages. And I just want to talk a little bit about the context. So you can have the most accurate warning or the most accurate forecast for that matter, but it means very little in the context of poor governance, poor planning, poor service delivery, poor communication, and poor readiness. If you don't fix these things, your forecast, the effort that you put in, is going to be of limited success. So what is the way forward? So we are being inundated, and actually we're living in very exciting times because cutting-edge technologies are being implemented. The CSIR project that was talked about brings in new satellite technology that we can utilize, numerical modeling advances that we have, machine learning and artificial intelligence is actually leading a very exciting time in our science. Then, obviously, the pillars of the early warning for all and the collaboration that needs to be focused is also of importance. And then finally, we have to keep our contextual realities in mind when we issue warnings. And finally, the issue of funding, whether we're spending our millions on or billions on adaptation or mitigation. I'm glad to hear that during COP30, which is the next COP event, the focus will be on adaptation. So this brings me to the final slide by just wanting to say that I think the 2 projects that I tried to convey to you, to my mind, they were part of the first projects that actually did not look at policy, but we actually tried to do something concrete in our activities within this project. Thank you, Chair.
Thank you for the very concrete overview of implementation and the next steps all the way forward, still the learnings from that. One question, someone?
Please, thank you very much. But this question, yeah, I mean, it's the current events that took place the eclipse of the red moon. Could we suggest there's a significance warning around the red moon that's just passed, or the 21st century shocks and aftershocks? So now how we gonna advise people if it's El Nino? People must be alerted to collect rainwater if maybe the next seasonal experience is going to be a dry season, to avoid fires or to be able to pick up fires for when it's a dry season. Yeah, thank you very much.
I don't know very much about the red moon, but regarding the message that I wanted to convey is that, you know, with all these new technologies that we are introducing within the forecasting environment, whether it's for short range or long range, and also in the case that I've discussed here, the very short range forecasts, it will improve the accuracy of those forecasts, yes. But there's a big gap between, you know, the weather services and the national disaster management centers and the provincial centers, and then finally the local government, the municipalities that we are working with, because they are also our agents in getting the message across to the community. But this is where the gap is. To get the message across in an understandable way, the people need to know how to react, and also they must know where to get the information so that they can be warned, because that builds the resilience with these forecasts. So as an organization, we focus on those aspects, and it's a huge task that we know that lies ahead of us as far as capacity building and training is concerned. So that is where the big gap is at the moment. But we are nowhere near bringing to you the perfect solution.
Thank you for that. Sorry for keeping your question maybe for the end of the session, but I would like to ask Mahal to come to the stage to deliver the final presentation, and after we can have some more questions about all the different presentations together. Thank you.
All right. Thank you very much. I'm very happy actually to present this morning about the work that we do in the space of understanding the projected changes in thermal comfort conditions in South Africa, and also to interrogate opportunity for integration of seasonal predictions in the health sector, climate variability preparedness. So this work actually draws from a number of projects that we did where we implemented this project in a co-design mode, where we'll be having research partners, and then we will also be having people who are service providers like Source, and then also users of the information. In this case, I'll be mentioning a little bit about the users of the climate information from the health sector. So in summary, what I'll be interrogating through the talk would actually be how do we tailor information such that it can actually trigger action on the ground? And I'll be picking few examples here and there. And of course, one of the clear example that you can locate is on the IPCC 6 assessment report, when they actually communicate these climate change signals that we have been talking about under different mitigation scenarios. From this picture, you can clearly see that a demonstration is made on trying to communicate climate change information, not by simply asking how the climate would look like, but actually go as far as asking what would the climate do, or what will be the climate that I'll be exposed to. In this particular case, you may ask, under these scenarios, we have been talking about 1.5, which has been said to have been existed for the first time. And then now we're talking about 2 degrees, a possibility of 2 degrees if these mitigation scenarios are not actually taken seriously. But now, in layman terms, sometimes these become complicated. So here we have an example which frames this question clearly into what would be the kind of temperature that a child or a kid born in 2020 be exposed to when they get to 2070. I think the color here you see is what Nico has referred to as uncharted territories. And of course, when the temperature are in these extremes, the early warning information become important as an instrument for adaptation. So we have actually been interrogating these changes in South Africa, looking at different scenarios in terms of what kind of exposure will be experienced in different regions. And what I can clearly say is that even with a robust mitigation, perhaps as embodied under SSP 126 scenario here, towards the end of the century, some of the temperatures that would be experienced will still be slightly higher than what has been experienced between the period 1979 to 2023. So this suggests that the issue of adaptation and being able to deal with temperature extremes is really important. It's probably a problem that has to be solved for a much longer time, as suggested by these global climate model projections for South Africa. Of course, when we interact with the user of climate information, the people who uptake the forecasts in the health sector, what is of much interest really is to unpack these changes in temperature into the feeling that a body would typically feel. So this takes us as far back as going into taking the meteorological outputs, combining them appropriately such that you can basically talk to a temperature that can be felt by the body. Here is an example of what is called Universal Thermal Climate Index. There are many of them. I think the first speaker talked about WBGT, which is another important one. But what I would like to point you to this analysis, which actually combine temperature, humidity, wind speed, and temperature, is that there are certain regions in South Africa, for example, the northern part of the country, where in the historic period, for example, 1961 to 1990, we're already seeing that, for example, Limpopo is warmer. The more darker redder you have, it's warmer. And of course, sometimes when we look at the numbers, we will say, of course, if a temperature goes above 25, it's not a degree, it's not really an extreme for that region, or if it is above 30, it's not an extreme as such, because people have acclimatized and they also know how to conduct their business and deal with such temperatures. But of course, if you go to the high-lying areas or even in the central interior, where you don't get such high temperatures, a slight shift in temperature could actually mean harm to people who have not acclimatized or who are actually not adapted for that region. So the learning that we get from this is that with these changes in the global climate temperature, it is very important to actually not make an assumption that there is a cross-cutting kind of way of understanding the risk. A risk has to be unpacked into its own context, because for the health sector, you may find that the shocks would basically, even if they are not the highest in terms of extreme, but it would really depend on how the communities in those areas are adopted to. And of course, as we go towards the end of the century, or at least 2 degree warmer world, we can clearly see from this map, which are basically trying to interrogate changes relative to this 1961 to the 1990 period, that there are areas, including even the high-lying areas in the country, which were not experiencing a high thermal discomfort. You start to see the shifts where the thermal discomfort is likely to also go there. Of course, if you were in the coastal regions, you would say, if you look at temperatures, absolute temperature, you might say, well, it is not high as in interior, but these thermal comfort indices actually tell you, if you combine humidity, temperature, and wind speed, you might slightly see that they are also concerning as well. Now, of course, we can interrogate these extremes from different angles, looking at heat waves, as well as their frequency and magnitude. And it turns out, with the increase in global climate temperatures, the number of heat waves are also projected to increase. And of course, we all know that with heat wave, we've had health warnings, in which case sometimes you would have extreme impacts that would even lead to loss of life. So the health sector itself has to actually to deal with the direct impacts as well as indirect impacts. And if you are coming from a climatology angle like myself, of course, this is a learning curve where you need to actually understand how sector experts would translate these impacts. And we hear of possibilities of various diseases that actually can shock the body, from heat stroke, heat exhaustion, which is of course a concern for people that are involved in outdoor labor. Temperatures might not be very extreme, but if you are already involved in energetically demanding activities outdoors, these heat waves could actually mean a lot and need to be taken into context in terms of having appropriate early warnings as well as appropriate education. Of course, the direct impacts go as far as impacts that affect the eyes, your skin cancers. You can also have burn cases, in which case these temperatures triggers wildfires. And then, of course, the vector-borne diseases also respond to some of these changes in temperature. One thing that has, of course, is often difficult to associate it with climate is the issue of mental health, which is very indirect, which often comes when a lot of things have already happened that tend to affect our mental health. Of course, accidents come when the extremes tend to push the body to its limit. And for people with pre-existing conditions like old age or some diseases, increases in temperature, of course, are found to also be posing serious challenges. And some of the statistics that we find in the literature is that when it comes to health, both the negative, of course, we talk of global warming and increases in temperature, but of course, if at time scales of interannual variability, there will also be cold spells or cold extremes. And studies that have been conducted have demonstrated that for vulnerable groups, for example, the young and the elderly, as you can see on the concavity of these plots, the more concave it looks, actually it's telling you the risk levels that are seen when temperature go to the negative as well as the hot extremes. And it turns out the young and the elderly tend to be affected the most, resulting even in mortality in some cases. So the numbers, if you look here in South Africa, the studies that have been done which interrogate the issues of mortality under both hot and negative extremes are actually concerning. And it's something that really needs to be taken seriously in the context of climate change, when things when the magnitudes might shift slightly from this period that has been studied, for example, in 1997 to 2013. So, of course, now the issue is how can we integrate the various types of predictions into preparing. I think Nico has talked in detail about the efforts that has been done by the South African Weather Service in terms of impact-based forecasting, and as well as nowcasting. Of course, there are many institutions, research institutions that are preparing, here in South Africa, for example, looking into the monitoring products like the ARC, as well as UP, which is also producing routine products that talk to seasonal climate watch. And of course, the CSIR, we also try to advance the F system model research by including some of the drivers that are relevant. For example, lately we have been looking at the drivers from the Southern Hemisphere perspective, trying to see if we can improve the winter season predictability, which is also important for the west coastal part of the country. And from this, we of course, we are aware that there are a lot of approaches that can be done from a scientific perspective. And there are also opportunities that can also come with the advances in machine learning and AI algorithms, which tend to help us to improve the process-based models. So these are some of the actually exciting things that have already been highlighted by Nico that would help us to improve the type of predictions and warnings that can be issued for the health sector specifically. So in terms of opportunities, I think there are many communities that are relevant. Here I've been mentioning the seasonal forecasting community, but of course there are health impact modelers that could benefit from integrating these outputs and then coming up with co-developed products through partnership, such that these science actually lead to sustainable and adaptation practices that can help us actually to deal with some of these projected changes in extremes. So in the end, warnings become important that combine the forecast and health data in a manner that actually is tailored for specific diseases. For example, your malaria and outbreaks, as well as increases in temperature thresholds. Of course, in the end, once you have the relevant information, you also need to have resources. Because when we deal with disaster, you can have the best information, but if the resources are not planned adequately, such that you can basically respond to the shocks in a manner that save lives, all the science would probably not really give us the impact that is intended. And of course, in the end, the policy frameworks need to be in place so that it is clear how the information is relayed from production into integration in decision making, as well as the necessary technologies that we need to have in place so that the information can effectively and smoothly move from the models that are used to the level where it can be integrated. And every part of this value chain is very important to optimize, and in consultation with the responsible parties. So the work that we have been interrogating in these climate services is how best can you optimize the value chains so that in the end you enhance the flow of information and the impact that can be reached. So perhaps maybe what one can say in the end is that in order to adapt, education and community awareness is very important. There are many things, for example, for the health sector that also becomes important: screening, education as well, proliferation of early warning, as I've highlighted, strengthening the provincial epidemic preparedness and response teams, and then also developing educational material. The health sector is very good at this, simplifying information such that things that have not been seen before can actually be easy for communities, even with very, low level of technical expertise to uptake and make decisions based on that. So the other thing is also to make sure that the information is actually appropriately mainstreamed for the targeted sector. In the end, the safety culture is very important, especially for schools, as well as outdoor labor practices where they are predominantly exposed to some of the extremes that are already happening in present day, as well as those that are likely in the future upcoming days. Thank you very much for your attention.
Thank you, Dr. Maho, for zooming in on the impacts of extreme heat on human health. Any specific question for Dr. Maho? And then we can also move back to the other presenters for some more questions to conclude this session. Yes, please.
Is your suggestion on improving? Oh, thanks. The suggestion you just made in your conclusion about how to improve outdoor labor practices. This comes from, especially, we've got expanded public works program, which one of its features is labor-intensive practices, and these usually happen, outdoors. So, what specific suggestion then would there be to actually assist those laborers who are in these, who would be affected by external extreme weather conditions? Thank you. A practical one.
Yes, yeah, I'll go with the practical ones, yes. Of course, there is a lot of research that is happening in this space, and a lot of it is happening in the Northern Hemisphere around how to improve the clothing, safety clothing for heat proofing for outdoor labor. The other thing is on the aspect of planning. So all the people that are involved in dealing with outdoor labor need to be having planning that is climate informed. Because the location where the outdoor labor is, one has to worry about whether if extremes happen, are there shading facilities where people can actually go there? Can we change the scheduling of the activities such that they are actually on peak when the people are less exposed? So can you shift the daily shifts? The other thing is, can you have water and break points where if there is need to cool down using natural means available, people can actually use those. Additionally, you also have to worry about having the emergency responses. Are they in the neighborhood such that people who are involved in outdoor labor can access this? And of course, the first thing is also to be able to detect when people are having hypothermia, for example, or heat strokes. So awareness and training is very important as part of the safety culture for outdoor labor.
Thank you. I want to open the floor to more questions for another 5 to 10 minutes. I think that's fine, since we're running in a big break now. So, yes, I will, yes, please. Maybe address your question to a specific speaker, then I can hand the mic to the right person.
All right, no problem. So the first question is to Dr. Mahal. I just wanted to ask you, there's a lot of guidelines and standards on safe operating heat conditions, especially in the mining and military sectors. What is the progress or the status of that in other industries, like in agriculture and all these other occupations that expose individuals to heat stress, in addition to the climatic changes? And also, how are the programs in terms of acclimatization accommodation being implemented? Because I know predominantly we find it in research, but what is that transferability within these industries? And then my other question goes to Nico. I just wanted to ask so with the recent technologies that are being used in forecasting, what is the accuracy and what is the time frame that one can forecast weather conditions? And then in relation to the preparedness of, especially like KZ and Eastern Cape where flooding has been occurring, what has been done thus far, especially with these disaster accommodation structures, what has been done thus far to then help in reducing the impacts of these flooding?
Yes, you have asked many questions, and I'll shift the other one to Nico, especially the one that talks about the timescales of forecasting and warning. You see, when you talk of acclimatization in the face of climate extremes, if you are dealing with extremes that, let's say you are seasonal extremes, drought, you might say, well, acclimatization can help you. But a lot of times extremes would come when the time scale of acclimatization and the time scale of exposure would be very short. So you cannot rely on acclimatization for certain regions. In terms of the institutional mainstreaming of heat safety, of course, the mining sector, the steel sector, and all the sector where people actually are predominantly exposed, they would have a proper safety culture. But for those sectors where we have really enjoyed a safety that envelope under a natural weather, then a lot of effort is needed to anticipate and prepare for the climate extremes. So this is an area of active research and engagement, because all these extremes tend to challenge the context, and there is multiplicity of context in which preparedness measures need to be developed. So it's actually not as advanced as you would have here in South Africa in the case of those specific sectors. So there's still a lot of effort, consultation and co-learning and co-development that needs to be made so that the safety practices are beefed up in anticipation of the projected changes in extreme temperatures. Thanks. Perhaps the one on timescales, if Chair, you allow me to shift it to other colleagues to talk to things.
Yeah, thank you for shifting it to me. Yes, the context of the different timescales with which all weather services are dealing with ranges from the very short range. I've talked about nowcasting, which looks at the 0 to 2 hours. We stretched it to 6 hours. But then there's the longer timescales, like your short range, which goes up to from day 1 to day 3. Medium range forecast goes up to 10 days ahead. And then we traverse the timescales, to monthly timescales up to seasonal. And then you get climate outlooks, which looks to the next 10 to 30 to 50 years. I always, and I'm a meteorologist myself, amaze myself that, we struggle to actually forecast for the next 5 or 6 hours, but yet we are forecasting 100 years ahead. Obviously, there are some science, different science, science expertise involved in each of those timescales. So we use different tools to actually forecast amongst those timescales. We call it a seamless forecasting timescales, which covers the very short up to the high extremes of climate change, which is 50 to 100 years. So I hope I've answered your question there. So we definitely have different teams of scientists with different skills that looks at each of those timescales. What are being done, you talked about the impacts of these floods, especially I think you were referring to 2022, the Durban or floods in KwaZulu-Natal. And yes, that is an incident that actually caused the loss of life of close to 500 or more than 400 people in that case. But what is lesser known is that that incident happened in April 2022. Exactly a month later, a similar event hit KwaZulu-Natal. without the loss of even one life. What happened is the question to be asked, because the South African Weather Service were wrapped over the fingers because some people indicated that they did not receive an early warning. Although we knew that early warnings were issued. We obviously deal, as I've indicated in my talk, with the national disaster management centers, the provincial disaster management centers, as well as on a municipal level. This is where actually the action takes place, is on municipal level. So it shows you that, you know, the last mile communication of early warnings, that is where the big gap sits at the moment. And I think the reason why that flood that happened in May, a month after the disastrous one, people were just more aware of the risk that you know, that flooding poses to them, and hence, if you are aware of the risk, you can actually build yourself some resilience and protect yourself. I think my slide in the end indicated that if you receive an early warning, you can save yourself, even if it's just 1 hour ahead of time. You can save your own life.
Yeah, I think that's a very powerful message to make that. But of course, we would like to have not real-life examples to warn us, but actually the warnings themselves to prevent the disasters. Maybe, I don't know if there are any questions also for our 2 or 3 other speakers. Would be good. Yes, please.
Oh, thank you very much, and thank you for all the presenters. I just want to give an observation, but it may also be a question, that in all that we do, we are giving very important information for saving lives and property. However, there is still the big elephant in the house with regards to what Nico brutally told us, the truth about having good early warnings, and even I think Dr. Mohau, if I pronounce your name correctly, talked about having these systems in place which are well informed by science and research. However, we know one of the failures we have is lack of investment in infrastructure on the part of the government, a lack of investment in technology. For example, if we want the technology in health to inform the impacts of extreme heat and so on human health, you find the technology is not there among the majority of the rural population and also the urban population. There is also a lack of sufficient communication of this information, and finally also education and awareness. Because, for instance, if right now there is a major disaster to happen, like a climate-related disaster, how many people are already connected to actually get that information? So before we come in to respond to it, something would have happened. People would have died, some things would have been destroyed. So what I'm throwing here is, as data scientists or as scientists in general, or people who are coming up with these solutions, how can we engage the policymakers? Because that's where, you know, the rain beats us. How can we engage them so that they can be either more proactive or more cooperative in terms of when we tell them that this is the information as researchers, as scientists, that we think can help us to plan better, to respond better, so that they, when they meet in parliament or they meet in those areas where they work on the policies, they can be able to. So for me, I'm throwing this not only to the presenters here, but also to the audience here. What would be the best way for us to engage the policymakers so that they can make more contribution on their part, rather than many people would blame us and say, you told us this information, but now what do? We do not have the technological capability, we do not have the capacity, and so on. Thank you.
Thank you for your contribution. I don't know, maybe Dr. Usman or Tatiana, if you have any comments on that.
Well, I I guess it's a contribution, and I think it's part of us. It's no well the business. I mean, policymaker is definitely important. We should, as someone mentioned, move from just the forecast to what people need really to do. And policymaker as the one who makes the decision. Of course, any kind of systems that you use, there is always some flaws, there is always some problems. But you need really to capitalize on what you have. So what I think, having the policymakers at the beginning, at the outset, what you're doing is very important, are not just as user, but as partner. When I policymaker, I'm talking about the decision maker, mayor, everybody, and the last mile. The second one is also to demonstrate. People don't know really what happened. If you have a pilot and demonstrate people really how things works, policymaker can make a better decision. But people want to engage, but sometimes they don't know, so we really need to document. What you mentioned about those channels of communication is very important, of course. We need to use as many channels as we want. Today we have the social media, we have of course the radio, we have the internet, we can use as much as we can. But of course, there is always something that is not working well. I mean, in our science, we know that data are really missing. We need more data, more observation. And also, we know that our products are given in a probabilistic way, and there's always uncertainties, and people sometimes ask questions, how do you ensure that it will happen or not? And so we need really a communication one, and demonstration for me, piloting is important. Having also people engaging in the project, not having pure research project, but having all those stakeholders in the project at the outset, so everybody knows they have to play a role and they're important. Those things, I think, if you take care of it, you'll be maybe delivering better.
Thank you. I thought there was another question here, maybe a last one for, if this question is still remaining. No, it's up to you. Otherwise, I just want to conclude with one last question. I think otherwise you can directly address the speakers, but I think we have to wrap up.
Thanks very much for the opportunity. I realize a lot of this early warning systems is more on climate impacts and maybe just as per the topic. What I was going to ask, because I saw what the colleague presented from Mozambique on your vulnerability and adaptation program for health based on climate change. I wanted to ask whether there is some consideration of One Health issues, so related to agriculture, food. We do have the one project that we've been working on One Food with a view to One Health, but we've primarily focused on the food side. So I was interested on some of what you were doing in terms of those indices on the health side, and because we want to expand what we're doing on One Food to some measurements, and quantifying some of the information on the health aspect. So yeah, just is there anything around that? And because of course, risk management and hazard management is it's actually quite an involved process. And talking about climate without that is also can be problematic in the project you want to develop. But yeah, just quick.
Thank you very much for the question. So, a very interesting question in terms of One Health integration in our Health National Adaptation Plan. As I mentioned, we develop a multi-sector approach, and the ministry now who's in charge of the piece of environment and who is also the focal point for climate change in Mozambique, it's the Minister of Agriculture, Environment and Fishery. So they were involved in the process since day one, in the process of development of this plan. And we had the opportunity to discuss during the different types of workshops that we had, different approaches related not only to agriculture, but for the animal health that we need to include in our health plan. And we have, I think we were lucky to have those people involved in the process of designing this plan, because I think now we have a very comprehensive plan for the health sector. And what is missing now is something that it will be a little bit difficult, linked to the issue of the policymakers. It's trying to engage everyone that were in the process of development so that they can appropriate of the plan. Because of course it's a plan for the health sector, but there's a lot of activities that should be implemented in collaboration with other sectors, or activities that other sectors will implement that will have impacts on health. So this will be our next step, actually. And thank you for the question.
Yes, thank you for all the speakers for their very nice contributions and presentations. And also thank you for the audience for staying a bit longer with us. I think you should all enjoy your lunch breaks now. So see you in one of the other sessions, maybe here afterwards.